to the A to Z Dentistry series. Today we're focusing on wisdom teeth. This video, disclaimer, this video created is for educational purposes. It is not intended to be a substitute for professional dental advice, treatment and diagnosis. Always seek the advice of your dental or healthcare professionals regarding your condition. The statements made throughout video are not to be relied on for diagnosis, treatment, or prevention, including suggestions made. Thank you. So what are the project goals? To understand what is a wisdom teeth and how knowledge can help. So the discussion about wisdom teeth. So wisdom teeth, if you open your mouth and you say ah, starting from the midline, the central incisor is 1, lateral 2, 3, 4, 5, 6, 7, 8. Is the last tooth to come through in the mouth. In some people, it never comes through. In others, it becomes imparted and it can become very painful. It's embedded in the jaw and you can only recognize it when a radiograph is taken. It's still there, and in some people, it pushes the other teeth forward. So, what is periconitis? Periconitis is inflammation of the gums. So, there are times people have inflammation around the gum and it's sore and it's bleeding, or the tooth has come through only halfway. So, what we give at times, mouthwash can help, or hot salt mouthwashes, but it is very important to keep the area clean. If you have the gum covering the tooth, and you don't keep it clean and food goes underneath the flap, it's going to lead to inflammation and very painful. So take, for example, one day you're at work and then Maria shows up and is complaining of toothache from this side of the mouth. And you keep on wondering which is causing the tooth. And they keep on pointing to this angle. And you look in the mouth and then you notice a piece of flesh covering the tooth. And all because Maria has not been keeping that area clean and food has been going underneath the flap. As soon as food goes underneath the flap, it causes inflammation. That is why it is very important to keep your mouth clean. So what are the symptoms? So symptoms are pain, can be very painful. There could be swelling and that's or inflammation. So it is important to go to the dentist for maybe antibiotics if the swelling is so big and leading to increased temperature. Also, mouthwash, you can use mouthwash itself, but you need to see your dentist. So the result is keeping the area clean. Now there is a guideline. In the past, if someone has got wisdom tooth pain, you will tell the patient, oh, take it out. But now there's a guideline. You need to have 3 bouts of infection. So, for example, you've had an infection for the first time, and then you cleared it with antibiotics, and then you have it a second time, and then you cleared it up. If you have it the third time, then it is time to have a referral for removal. Now, what you have to bear in mind, when you're taking out a wisdom tooth, some of them can be very complex and may need a surgical removal. That is moving the gum away, taking the tooth out, and putting a stitch across. So it's very important to rather keep it clean, prevention, because there are times if you have the extraction, you end up with post-operative pain, swelling, numbness of the lip and the tongue, and in some people, they never recover from it. That is why you don't say that, oh, I've got a wisdom tooth, I need to take it out. You need to give it time to heal and see whether it will happen a third time before you decide to take it out. And normally, if you want to decide when you are ready to take it out, the complications are pain, breaks pain, alternatives do nothing. Doing nothing is an option and keep it clean. Or, as I said, you need to have 3 bouts of infection before you decide to take it out. It's very important to share the knowledge and please subscribe for updates. See you in the next video. Thank you very much for staying till the end and see you in the next video.